I am America's Health Coach.
All right, about 98% of people will suffer with back pain at some point in their lives, but there's a back pain that's extremely painful that many people struggle with. It's called sciatic nerve pain or sciatica. Now, the sciatic nerve, first of all, is the biggest nerve in the body. It's about that big around. It's huge. And so it comes out through the lower back of the pelvis into and down through the leg all the way down to your foot. Now, there's a muscle that wraps around the nerve called the piriformis muscle. And what happens is when you get that pain in the rear end and it begins to really throb and hurt, what that is, the piriformis muscle, it's actually spasming around the nerve. So what do you do about that? First of all, don't just take painkillers and hope for the best. You want to get to probably a chiropractic physician, do some decompression therapy, or even physical therapists do great work as well. But to get someone to look at that and do rehabilitation measures, muscles to work the muscle around it, stretching, and then also to make sure that nerve is not inflamed and there's no restriction in it as well. Usually it takes multiple treatments to get that taken care of, but one of the things you don't want to do is leave it, okay? Because here, again, if a house foundation was messed up, if it was tilted, or if there were a few bricks that were cracked, you wouldn't just take a water hose and squirt it. Okay, you would go in and actually repair that area to make the foundation strong again. The same is true with our structural part of our body. It doesn't matter if it's the middle back that's rotated or there's disc that's degenerated, whatever it might be. It doesn't matter if it's a cervical spine or the lower back or the tailbone. You have to do something structurally if it's out of position to put it back where it needs to go to give the body better function. And that's one of the greatest things you can do with either chiropractic care, physical therapy, whatever you choose, but get that area looked at so the rehab can be done to get it back where it needs to be and give you the best performance and function that you can have.